Thank you for taking time to join us today on our YouTube and internet radio FEBA Online. To share your thoughts with us, please message us at +91 6364 252164 or email us at info@febaonline.org. In the past 1 year or more, the COVID-19 pandemic has changed people's lives. It has brought with it much devastation, pain, and loss. The coronavirus is mutating. To give us a good insight and understanding on how they easily spread, whether they could cause more severe illness, and whether currently authorized vaccines will protect people against them today, we have in our show today Dr. Sudhakar, who will be giving us a deep insight on this subject. Thank you, Doctor, for taking time to be part of the interview today.
Indeed. Thank you, madam. Good evening to all.
Thank you. Dr. K. Sudhakar is at present resident doctor at Madurai Medical College, Department of Neurosurgery. He has completed his studies from Vinayaka Missions Medical College and Hospital in India, MCH Neurosurgery from Madurai Medical College, India, WFNS Fellowship in Neurovascular Surgery, Japan, Certificate in Fundamentals of Health Research, NPTEL, India, WFNS Fellowship in Endoscopy Skull Base Surgery, Carlos Higher University, Spain. His areas of interest are in traumatic brain injury, neurocritical care, neuroendoscopy, and epilepsy surgery. He is the author and co author of many journals. Dr. Sudhakar has worked in organizing numerous government programs and has involved in scientific way of analyzing epidemic outbreaks and trained in life-saving anesthetic skills in emergency care and was instrumental in bringing down maternal mortality, improved institutional deliveries in hospital areas, and interested in scientific way of analyzing and managing various neurological illness and research. Welcome, doctor. To begin, I would like to ask you the question, what is coronavirus? Can you give us an understanding of what is coronavirus?
Thank you, madam, for your kind introduction. Indeed, it's a pleasure for me to engaging in this. Coronavirus, COVID-19 in short form, coronavirus infectious disease is a RNA virus. It's a virus, actually. This virus was ubiquitous before 2019. It was there everywhere in the world. Okay, it is not new to this. It is not a new to the world, or it is not causing infection just from 2019. It is not like that. It was there. It was causing mild respiratory illnesses, and it was an ubiquitous virus. It was present everywhere. The problem now is the variation, the mutation which has happened in the virus has caused a grave concern for us. Why? Because more infectious rate, more transmission, and lethal. These viruses have become lethal. That is the problem now. The problem started from December 2019 when cases have been getting reported from Wuhan with patients having a severe respiratory illness. That is severe acute respiratory syndrome features, and the patient are becoming lethal, and they have become they the viral illness became a fatal one for the patients. Here, this virus is any other virus. It has a protein core. That is, it has a protein core made up of numerous proteins, and they have given alphabetical acronyms for it. For spike protein, it is called an S protein. For membrane protein, it is called an M protein. For envelope protein, it is called an E protein. And for nucleocapsid, it is called N protein. So all these four proteins form the structure of the coronavirus. Okay. For replication, for multiplication, this virus has RNA. RNA as a multiplicating factor. Okay. The problem with this coronavirus, the specific S protein, that is the spike protein, that has more affinity for ACE2 receptors. ACE2 receptors are the receptor which is present in our body, especially in the lungs, kidneys, blood vessels, brain, intestines, all other factors. And these places, these receptors are there. So this COVID virus has more propensity to go and get attached to these receptors and they can cause damage. So this coronavirus is not a new one. It is already, it was there, it was ubiquitous. So the infection is very common nowadays. Just because it has become lethal, it has caused grave concern for us. And more thing is the protein, the nomenclature is based upon these proteins.
Thank you, doctor, for helping
Yeah,
us understand that the virus has been present, but now it is because it is mutating, it is become lethal.
yeah, very good.
Okay. So, why are there so many COVID-19 variants and mutations? Now we are talking about variants, mutations. Help us understand this, doctor.
Yeah, this is a good question. Actually, I can give an analogy. The
Okay.
analogy is a checker box. Checker box. Okay, you can change the cube wherever you want, however you want, whatever way you want, but the same checker box will be the same. Okay, the structure, the model doesn't change. Okay, these checker boxes are the amino acids. Actually, these proteins are chain of amino acids. They
Okay.
are chain of amino acids. This S protein is a chain of amino acids. Any change in this amino acids will cause mutation. Okay, their position or their content or their deletion. These three things will cause mutation. This amino acids either may undergo change, a different amino acid can be substituted there, or that amino acid can be removed from there, or the amino acid can change the position. These kind of things happen in the proteins so that it causes mutations. You can have an analogy of a checker box where the cubes can be replaced and the mutation can happen in numerous ways. Numerous ways. It goes for what to say. It goes for innumerable ways of
Okay.
combinations and permutations to have variants. WHO and Communicable Disease Control Center, Atlanta, have given a classification based on Greek letters, which is common to us actually.
Okay.
Alpha, beta, gamma, delta, epsilon, theta. These are the Greek letters which can be denoted for the variants. Two things are very important here is WHO has given variants of concern, variants of the concern which have a transmission which is more transmission and they are more lethal and infectivity rate is very high. These variants are variants of concern, especially alpha, beta, gamma, and delta. Okay,
Yes.
variants of interest are epsilon and theta and are numerous other Greek alphabets. So
Okay.
we can keep it as a Greek alphabets, and that doesn't concern us because these variants are not going to concern us. But the particular segment, the one which is mutating, will give an innumerable ways of projecting into the environment, and we are the medical community are geared up in charging behind these innumerable mutations, so that so many variants are happening here and there, and every time we are going back behind them to chase them to give better to study and to analyze their better way of thinking.
Okay. So, based on this, my next question is, which variant, COVID-19 variant, should
Yeah,
we
which
be
variant? Which it's a good
more
question
concerned about?
actually. Yeah, it's a good question actually. Delta and Delta plus variant are of more concern to us
Okay.
now because of the lethal factor and the transmissibility, and it has happened in the
Yes.
Western world. But in India, India has the transmission is happening now here and there, but it is not universal. It has not spread to throughout India. So we have to wait and watch. Delta and Delta plus variants are more variants of concern now happening in India.
Okay. So, what are the treatment for these variants which we
No,
should
the
be
thing
very
is,
concerned about?
yes, very good. The thing is, virus is the same.
Okay.
Virus doesn't change. Okay, virus is the same. The structure is the same. The way of attaching to the receptors are also the same.
Okay.
Okay, the way of them going attaching to the angiotensin converting enzyme 2 receptors are also the same. Okay, their behavior is different. That's
Different.
all. Okay, their behavior is different. Behavior is in the meaning of transmission, in the meaning of lethal, in the meaning of fatality, in the meaning of recovery from the illness. This is the one which causes concern for us. The treatment modality has not given a big change. It has not shifted. It doesn't have a makeshift rather than when we started in 2019. But we have learned a lot of insights by treating the COVID-19 patients. COVID-19 patients, the virus has more propensity, more prone for causing numerous clotting fact, clotting
Okay.
coagulation abnormalities, so that it causes abnormality in the functioning of the lungs and the brain and the heart, so that patients are suffering more. So these kind of treatment strategies have been developed so that we can have a better understanding of this virus. The treatment doesn't change for each and a specific virus, but the propensity of their lethality is a grave concern that we have to watch for. That can be modified then and there when it is having a proper checks and balance.
So the symptoms that we as lay people, as common people, whether it's a Delta plus variant or a Delta variant or whatever the variant of the coronavirus itself, so are the symptoms similar, or should we be cautious and be aware of something more to be looked for?
Yeah, even for the we doctors, the Delta variant is a result which outcome which has come after a genetic study, which
Okay.
is not normally done for all patients.
Okay.
Okay, so it is a genetic study which is telling us that is mostly it happens after some 10 or 15 days after virological institute gives a report. Okay, that is not going to alter the change in treatment plan.
Okay.
Okay, symptoms. I have already told you the AC angiotensin converting enzyme receptors, they are present in lungs, so they will have more propensity for involvement of the lungs, respiratory difficulty in breathing, and in the nasal passages, difficulty in smelling, and in difficulty in taste, and in the heart. Patient develop cardiac arrest, imminent myocardial infection, and in the ACE2 receptors present in the intestine, patients develop diarrhea, and kidneys, patients develop renal failure. And these kind of symptoms are there right from the beginning for COVID virus involvement.
Okay.
So the management is not very particular about these symptoms. The management is treatment of the COVID illness. That's all. It is the same. It is the propensity to infect, the propensity to transmission, and the lethality is the one which changes with each COVID variant illness.
Now, we have heard many people have been infected and they have recovered. Now, can a person get reinfected? Now, whether it is with the coronavirus again or with a new variant, is there a possibility to be reinfected, doctor?
Yeah, I have already answered this question in another way,
Okay,
because the virus is the same. Only the variants are getting mutated with the amino acids. That's all.
that's all.
The
Okay,
patient can get reinfected,
okay,
can get reinfected at any time in due course of their life, just because the antibody titer, the antibody level is not that very effectively develops after each and every infection. Some of them develop some 80% or 90% antibody titer. That is
okay,
very good for them so that they won't get infection again. But
okay,
some of them gets very, nil zero antibody titer. The
okay,
antibodies to fight against the infection, even after exposed to the infection, the patients develop zero antibody titer, and they are getting infected again.
okay,
Reinfection is common, especially for this COVID virus, because the variations in the developing of the antibodies.
okay, okay. Now, the question of vaccines. Now, the vaccine drive is full on in our country, and
Yeah.
some of the people do have a concern, maybe because we are not very aware of what the vaccines are and all the details about it. Will the vaccines protect us against the virus? And can you explain a little bit about how the vaccination works against this
Yeah,
virus?
very good, very good. Of course, vaccine is the only mantra for us now.
Okay.
Only mantra for we have only solution for COVID-19 is to get rid of COVID-19 is vaccines. That is, we have to protect ourselves. We have to create a barrier, either a physical barrier or a physiological barrier. The physiological barrier is the vaccines. Okay. The vaccines are developed based on these proteins, based on the nuclear capsid, based on the RNA. So these vaccines, they mimic, actually they are similar to the proteins which are present in the virus, and they create an antibody response in the body. Okay, and sometimes the vaccines are produced by giving a killed virus, inactivated virus.
Okay.
Sometimes the vaccine are produced by a multiplication of numerous this thing RNA, mRNA based vaccines. These vaccines are produced so that they create an antibody titer, effective antibody titer. Vaccines are the only mantra so that we can get rid of this COVID vaccines. So many types of vaccines are there. The science is advanced so much, and we are finding each and every way, each and every loophole, so that we can unlock the key, unlock with the key. The key is a vaccine. The key is a vaccine. We can unlock with the key, and that can be only done with the vaccine. And there are numerous ways of developing vaccines. Each one is are having their own efficacy.
Okay.
It doesn't mean that one is inferior, one is superior. They are all in their numerous ratios and proportions. They are all in probabilities. They are all in probabilities. 95%, 80%, 80%, 90%, 60%, 70%. But no one knows in which probability we are, whether in the 5% probability or in the 95% probability. But only mantra we have is to get rid of COVID-19 viruses. Vaccine, vaccine, vaccine. Universal vaccination is the mantra, and we have to go about it, and we have to go. We have to acknowledge it. We have to acknowledge it, and we have to readily take it over, so that we can eradicate this pandemic, and we can come out of this pandemic easily.
Thank you, doctor. And
Yeah,
once a person takes the vaccine, there are side effects, like
yeah.
what a person should do, shouldn't do. After, can you explain this little bit
It's
for
a
our
very
listeners?
good question. It's a very good question. I understand the apprehension. I
Yes,
understand the anxiety behind the vaccines. The
yes.
problem with the vaccines is all vaccines, they mimic the infectious agent.
Okay.
They mimic the infectious agent. So they have to they somewhat the other, they may create an illness somewhat. How will we come to know that we are having illness? We'll have body
Body
pain,
pain.
we can get fever, we can get a headache, and we will become tired. And these are the adverse effects of the vaccine. Very simple, very simple. And these are minor illnesses, and which will come, so that we can make it out that the vaccine is working in our body. It is eliciting the antibody response, it is increasing the antibody. These can be overcome by small mild analgesics or antipyretic drugs, so that we can overcome it. There is no fear about the vaccines. There is no apprehension about the vaccines. There should be no anxiety about the vaccines. One more thing is mRNA based vaccines. They are causing vaccine related illness, especially demyelinating illnesses, have been reported. That is very rare, and it can happen to any drug which we can take. So for the vaccines, with the benefit they give, the benefit outweigh the risk. Actually, the benefits they give outweigh the risk. So we have to go with the vaccine, and we have to go about with the vaccine.
Okay. Doctor, since you're a specialist in neurological field, and you work in that field, I just have a question for you as to what are the neurological complications of coronavirus infection?
Yeah,
Have you?
thank you. Kindly ask my field of interest.
Yeah.
The thing is, COVID virus. It is what I told you. It is already ubiquitous.
Yes.
Okay, ubiquitous, and they are more propensity to get attached to the ACE2 receptors, which are present in the blood vessel, intestines, kidney, heart, and in the brain and the nasal passages. Okay, so these receptors, spike proteins, they get attached, and they cause damage to the nerve cells over there. Especially when it get attached to the nasal passage, we develop symptoms of loss of smell. Okay, when it gets attached to the receptors in the taste receptors, we get symptoms of loss of taste. Okay, these are minor neurological symptoms, but when it get attached, it causes an auto antibody response. It causes auto immunological response, so that it distracts the nerve tissue. It distracts the nerve
Okay.
tissue. That we tell it as demyelinating disorders. Okay, demyelination is the destruction of the nerve tissue because of the antibodies produced by our own body. They are called as auto antibodies, and they can produce diseases like Guillain-Barre syndrome and multiple
Okay.
sclerosis, which are the rare events can happen.
Okay.
I have already told you that ACE2 receptors are present also in the blood vessel, and it causes numerous clots in the blood vessels. So it can cause symptoms of stroke. Patient may develop stroke, either blockage of the blood vessel going to the brain, or patient can develop bleeding in the brain, especially intracerebral hemorrhage or ischemic strokes or subarachnoid hemorrhage, and weaknesses of the muscle, such as the Guillain-Barre syndrome, demyelinating disorders like multiple sclerosis can happen in COVID-19 patients, either at the acute stage of illness or during the post-recovery phase also, patient can
Okay.
develop.
Uh,
Thank
and
you.
during this unlock period, as a
Yeah.
layperson, what are the things that we need to keep in mind? What should the people do, shouldn't do? Can you just tell us?
Yeah, this is a salient question. This is a salient question, right question to be asked at this juncture. We are not unlocked. Don't ever
Okay.
think that we are unlocked. We are still in the danger of contracting the COVID-19 virus.
Okay.
Either the patient get infected or the patient in unlock period, they are always monitored by the COVID-19 infection, and then they can get anytime this COVID-19 virus. So three things have is a must. Three things are must: safe social distancing. We have to develop a personal space around us. We have to develop a personal space around us, and we have to keep in mind that our personal space is very, very important. The second is, we have to develop a physical barrier around us. Physical barrier by the way of mask, wearing masks, especially that is the one which protects us from the contracting the infection soon, and safe social distancing, and get
Yes.
avoiding crowded environment, avoiding getting engaged with crowds are the most important factor. And I have to ensure, I have to emphasize on this thing, that unlock period is not unlock, it is not unlock, it is a time they have given us to recheck and go back and rethink what we have done wrong, and we have to correct them, so that we have to fight this virus together always.
Yes, we are still in the danger zone, and
Yeah, of
we
course,
need
of
to be
course.
cautious and
Yes.
take care and be safe. So, thank you, doctor, for giving such a wonderful understanding of the COVID-19 virus, the variants, what we should be careful about, what we need to take into consideration, and just in a very crisp way that you have put it across to us in a way that we can understand that we still need to be cautious and continue to do the things which the protocols, follow the protocols which the government has given, and also in order to protect ourselves. So, thank you, doctor, for helping us to understand this.
Thank you, madam. Thank you very much.
So, on
It's a
behalf of
pleasure talking to you. Yeah.
thank you, doctor. On behalf of FEBA India, we wish you the very best in your future endeavors. So, to reach out
Thank
to
you.
us, please call us at +91 63 64252164, or email us at info@febaonline.org. Thank you for listening, and please share this link and information with friends and family. Stay safe and God bless.